Immunogenicity does increase the risk of infusion-related reaction, simply because once we start reacting against the enzyme replacement therapy, we can release histamine that can be responsible for anaphylactic reaction or other types of hypersensitivity reaction. Decreasing the immunogenicity would help making sure that patients continue to receive benefit from enzyme replacement therapy. I had patients who developed severe immunogenicity 4 or 5 years after starting enzyme replacement therapy. In the majority of cases, it happened earlier than that, but not necessarily. So having a product that it is less immunogenic obviously would help making sure that the effect of replacement therapy continues with time. The majority of patients tolerate the infusion relatively well. They don't have much of a problem. But we have a minority of patients that might be 5 to 10% who might even have to stop enzyme replacement therapy because they cannot tolerate it. And when that happens, the disease progresses. And you have a worsening of kidney function and especially worsening of the cardiac function. The heart has always been a problem in Fabry, but before enzyme replacement therapy, most patients develop kidney failure before developing heart failure. Now what we are seeing is that with enzyme replacement therapy, the kidney continues to last longer, but many patients develop cardiac complications. So having a product that is less immunogenic could decrease the risk for this complication. Anti-drug antibodies are the response of our body to a foreign antigen. They happen not just with drugs, they happen with anything that our body has never seen. What we do, we process what comes from the outside. There is a special system of cells that breaks down what it is given extra, which we call antigen, and present it to antigen processing cell that will mount an antibody response. And the antibodies will interact with the foreign protein to try to neutralize it. In general, this process is the one that we use to fight viruses, to fight bacteria, to fight anything that can harm us. Obviously, the body does not know that enzyme replacement therapy is a good thing for us, for the patient with Fabry. And that is why they see the enzyme replacement therapy as a foreign antigen that needs to be destroyed. So antibodies are the way that the body tries to do to destroy anything which is not proper of the body.